1. How Trump's budget cuts could impact Medicaid, Nevada, California, and Louisiana at risk. 2. Why healthcare lobby failed to block Medicaid cuts in Trump's bill. 3. Trump's Medicaid cuts threaten millions in Massachusetts. What you need to know. 1. How Trump's budget cuts could impact Medicaid, Nevada, California, and Louisiana at risk. The impact of Medicaid cuts. A closer look at affected states. In a bold move, President Donald Trump has proposed a budget bill that threatens to significantly reduce funding for Medicaid, the largest public health insurance program in the United States. This decision is poised to have varying effects across different states, with some facing more severe consequences than others. According to insights from Barclays Plc, a prominent financial services company, the states of Louisiana, Nevada, and California are likely to bear the brunt of these cuts. The analysis conducted by municipal strategists Mikhail Folks, Francisco San Emeterio, and Grace Zinn highlights that these states could experience substantial funding losses, particularly when considering the percentage of their annual revenue that Medicaid represents. Additionally, the number of residents in these states suffering from chronic health conditions exacerbates the potential impact of these cuts. But here's where it gets controversial. The implications of these cuts extend beyond mere numbers. They touch the lives of millions of Americans who rely on Medicaid for essential health services. As we delve deeper into this issue, it becomes clear that the stakes are high and the conversation around Medicaid funding is more critical than ever. As we consider the future of Medicaid, one must ask, how will these proposed cuts affect the most vulnerable populations in our society? Are there alternative solutions that could address budgetary concerns without sacrificing the health and well-being of millions? We invite you to share your thoughts and engage in this important discussion. 2. Why healthcare lobby failed to block Medicaid cuts in Trump's bill. It's a rare moment when America's formidable healthcare industry, doctors, hospitals, and insurers, comes together in warning lawmakers that cuts to Medicaid will devastate millions, yet still finds itself outmaneuvered. In early July 2025, President Donald Trump, with united support from Republicans in Congress, signed the One Big Beautiful Bill Act into law, ushering in deep reductions to Medicaid, food aid, and other essential safety net programs. The move sent shockwaves through the healthcare sector, revealing just how much Washington's traditional power dynamics have shifted. For weeks before the bill's passage, healthcare groups painted a dire picture for Congress. Reductions in Medicaid, the massive state federal health insurance program for low-income and disabled Americans, would strip health coverage from millions, close hospitals, and upend entire communities. Medicaid, after all, covers nearly a fifth of all hospital care in the U.S. and serves as a lifeline for those who can least afford to lose it. Yet despite these alarm bells, Republican lawmakers not only ignored the warnings, they dug the knife in deeper, accelerating the cuts before sending the bill to Trump's desk, where he eagerly signed it on July 4th. Here's where it gets interesting. Healthcare lobbying is usually one of the most effective forces in Washington, with a long history of stopping or softening laws that threaten the industry's bottom line. But this time, even united, the medical establishment couldn't prevent what many now see as a historic defeat. The speed at which the bill moved, fast-tracked through Congress in less than 2 months with only GOP votes, left lobbyists stunned, scrambling to assess the damage. So, why did the healthcare pressure campaign falter? Lobbyists point to several factors, but nearly all agree on one controversial point. GOP lawmakers were more concerned with avoiding a row with President Trump and his potential to derail their careers in the 2026 midterms than with protecting local hospitals or vulnerable constituents. As Bob Coker, a former Obama administration official and veteran health policy analyst, puts it, many in Congress saw Trump's threat of a primary challenge as more frightening than angry voters discovering their hospital was shuttered or their insurance rates were skyrocketing. Consider the case of Senator Tom Tillis of North Carolina, who publicly spoke out against the Medicaid cuts, only to be immediately targeted by Trump with promises of backing a primary challenger. Tillis quickly announced his retirement soon after. But the story goes even deeper. There's also lingering political tension dating back to the Affordable Care Act, ACA, or Obamacare, which remains a sore spot for many Republicans. Despite its bipartisan roots in Senate negotiations, no Republican ultimately voted for the ACA, and the law's expansion of Medicaid remains a symbol of Democratic achievement. Many hospitals and health centers became vocal ACA supporters, a move that effectively painted a target on their backs. Republicans remember who backed Obamacare, and there's simply less goodwill toward these institutions than in the past, Coker explained. Cece Connolly, who leads the Alliance of Community Health Plans, recalls spending extra hours on Capitol Hill with lawmakers and their staffers, warning about the real-world consequences of the bill, only to be met with a singular Republican focus on delivering a major legislative win for the president. Even moderate members, who may have hesitated, were ultimately swayed by party unity and the allure of tax cuts. The only notable concession was a $50 billion relief fund for rural hospitals, a move that, while helpful, does little to offset the trillion-plus dollars in Medicaid cuts projected over the next decade. But here's the twist. Some of the lobbying efforts did bear fruit. The industry managed to block even deeper cuts to Medicaid, including proposals to reduce federal support for states that expanded Medicaid under the ACA and attempts to impose strict caps on federal funding. Both measures would have piled billions more onto the cuts already on the table. However, the new law does impose a controversial work requirement for millions of Medicaid enrollees gained through the ACA expansion. Adults must document 80 hours of work or volunteering each month. Experts estimate this alone could push nearly 5 million off the rolls by 2034. One of the most significant and controversial aspects of the law is how it limits states' long-standing ability to use provider taxes to draw down extra federal Medicaid funds. For decades, hospitals have supported this system, arguing it helps offset Medicaid's low reimbursement rates. But conservative think tanks painted the practice as a form of legal money laundering. And Republican lawmakers evidently listened, especially those already frustrated with the health industry's support for the ACA. In the end, Congress agreed to delay the provider tax cut until 2028, giving hospitals a few years to regroup. In rural corners of America like Mansfield, Louisiana, hospital CEOs like Todd Epler are navigating the fallout. While relieved by the Rural Health Fund, thanks in part to advocacy from House Speaker Mike Johnson's district, many are anxious about the long-term impact on their patients and communities. Hospitals have long warned that Medicaid funding reductions would mean layoffs, service cuts, and even closures, arguments that often make lawmakers think twice. But this time, those warnings fell flat. There was a sense in Washington that hospitals could absorb the hit, and even skepticism that lobbyists could have fought harder. The American Hospital Association, for example, spent millions on anti-bill TV ads and issued stark warnings about the human toll of the cuts. But some insiders admit the campaign may have been too soft, too little, too late. Other major health groups, from the American Medical Association to the National Association of Community Health Centers, also mobilized, pressing lawmakers with phone calls, emails, and in-person appeals. Their efforts saved nonprofit clinics from planned copays and secured temporary Medicare payment bumps for doctors, though industry leaders openly admit these are scant consolation when weighed against the broader impact. So, what can we learn from this episode? The healthcare lobby remains a force, but in this polarized era, its influence is eroding in the face of party discipline and presidential ambitions. The Medicaid cuts will reverberate for years, disproportionately affecting rural areas, the disabled, and the working poor. And while $50 billion in rural funding is real money, it's far from a solution for the millions who could lose care. But here's a question to spark debate. In your opinion, was the focus on tax cuts and party unity worth the human cost of reducing Medicaid? Or is this a case where short-term political gain comes at an unacceptable price for the nation's most vulnerable? Do you believe hospitals and health systems did enough to fight back, or should they have taken a bolder stand? Let us know in the comments. We want to hear your honest, unfiltered views. 3. Trump's Medicaid cuts threaten millions in Massachusetts. What you need to know. Imagine being told you might lose your health insurance, but you had no idea you were even enrolled in a government-funded program. That's the reality for millions of Americans, and it's about to get worse. President Trump's big, beautiful bill, is set to strip health coverage from an estimated 300,000 people in Massachusetts alone over the next decade, according to state health officials. But this is just the tip of the iceberg. But here's where it gets controversial. Under the new tax law, Medicaid is facing cuts of over $1 trillion over the next 10 years. Starting in 2027, adults will have to prove they're working 80 hours a month, are in school, or are doing community service to keep their benefits. This requirement alone could leave millions confused and at risk of losing coverage, especially since many don't even realize they're enrolled in Medicaid. And this is the part most people miss. You might be one of them. Millions of Americans are on federally funded Medicaid, but don't know it because their state-branded health programs sound nothing like Medicaid. Husky Health in Connecticut, Sooner Care in Oklahoma, Badger Care Plus in Wisconsin, they all fall under the same federal umbrella but operate under different names. The variety of names from state to state only adds to the confusion, and it's not just about semantics. People might not realize they're at risk of losing coverage if they don't understand their health program is part of Medicaid. And this is where it gets really interesting. Historically, Medicaid recipients have underreported their enrollment. Government records show 78.5 million people were enrolled in 2023, but only 62.7 million self-reported they were on Medicaid that same year. That's a significant gap, and it's a clear sign that many Americans don't even know they're enrolled. But here's the kicker. If you're one of the millions who might be affected, you're not alone. The changes will affect nearly 71 million people on Medicaid and 7 million on the Children's Health Insurance Program, CHIP. And it's not just about losing coverage. It's about the burden of new paperwork requirements and the potential for life-altering consequences. So, what do you think? Are these changes necessary to curb waste, fraud, and abuse? Or are they just another way to strip vulnerable Americans of their health care? Share your thoughts in the comments below. The Republican-led revisions will require adults between 19 and 64 to verify their work status twice a year. Critics argue that these changes will target Americans who are eligible but will struggle with the paperwork. And the irony is, many of these people are already working, caring for family, or dealing with disabilities that limit their ability to work. The changes will place a significant burden on states to fund these critical programs, and it's likely to result in more people becoming uninsured. The federal government currently pays for 69% of Medicaid costs, and cuts will shift more of the financial responsibility to states. As the dust settles on these changes, one thing is clear. Millions of Americans are about to face a healthcare crisis, and many won't even realize what's happening until it's too late. Are we prepared to let this happen? The choice is ours.